So I don't know about you all, but when I was a social worker in training, I can recall lots of conversations about empowerment, boundaries, and some sprinkling of self-care. What I cannot recall is one conversation about showing up as your authentic self. Now, maybe that is because I chose a clinical track, or maybe it was not yet the buzzword, but come 2020, I learned that the most valuable thing when supporting the team while navigating work from home and all the other piles of things that came with this past year is that when I show up as who I am, it gives permission to others to do the same. How can we, as helping professionals who are taught to be these blank slates for others, show up as authentic selves to create more genuine and meaningful relationships? Some context for you all as we go further into this conversation is for the past several years, I've been managing a community-based team, working within a healthcare organization here in Philadelphia, which has been an interdisciplinary team with various roles of coordinator, community health workers, social workers, and a nurse, and a variety of cultural and racial backgrounds. There's something that you should know about me. I'm one of those people who has a very strong belief that when I'm in my home, it's pretty much sacrilegious to be wearing anything such as jeans or honestly looking very nice in general. In the first few months of work from home, our network was busy adjusting to remote work and collectively decided that having our cameras on was still not a need. So for the first months, I'm working through managing a team in which I didn't want to see my team's faces. And in the midst of all this craziness, perhaps it was not the worst thing. Now, I've been a community-based social worker much of my career, and most of the time I have spent supporting folks in their homes or in the communities that they are a part of. So I have always considered it a privilege for them to invite me in and to allow me to see their world as it is. But as a social worker, having others see inside your home is not something that I ever really had to think much about. For me and my introverted self, my home is the time that I need to be able to decompress from work and supporting others. So I was pretty uncomfortable in the beginning with cameras showing all the various aspects of my home. And perhaps when the cameras were first turned on, I spent a little bit more effort putting myself together and adding on my social work cardigan. I know you know what I'm talking about, instead of my sweatshirt. And then I realized that that is really not who I am and not how I feel comfortable spending any kind of time inside my home. So if I was feeling that on some level, I could almost guarantee that there are others within my team who were also feeling that. So the first thing in really being authentic is naming what is being felt. I recognize that as a leader, I hold an unequal distribution of power. And particularly as someone who is white, that is another level of power that comes into play when working with team members of color. What I do believe is that as a leader, if I do not show up as who I am, how much more difficult is that for others on my team? If I say come as you are, but I can't even model it for myself, what is that really saying? Authenticity always goes hand in hand with vulnerability. And with team members of color, this year has been much more draining than others when it comes to forcing the energy to show up and having to perform right in the job. And though I cannot ever guarantee safety, I began to make sure that what was done is to create the space for people to share themselves outside of their role as a professional, or sometimes just to simply name where they were at. However, one can't do that unless you take the step to be vulnerable. So one team activity I facilitated had me showing off one of my most special possessions, my teddy bear. And this in turn led to others on the team sharing parts of themselves that were very meaningful. Was I uncomfortable sharing something that seemed so unprofessional? Absolutely. But here is the thing. change is uncomfortable. And what is more important to me is that I am genuine about accepting all team members for who they are. Now, if you would have asked me just over a year ago if I would have been talking about my teddy bear at work, I would have laughed and just shook my head in disbelief, because here is the thing. We are all humans first. I recognize that in many aspects that continues to be ignored by many because it does not serve them. But this past year forced us to remember that almost every day we showed up to work, even if you weren't working from home. We are humans first. So that is where we started as a team. We named being uncomfortable. We discussed connecting how, if this is how you are feeling, how are others doing? We acknowledge that the concept of turning your personal self off and showing up as your work self is this other world notion that perhaps we don't really need to bring back. I encourage time off and using parts of the workday to take care of yourself so that you can show up better for the family that you have in the other room, or the clients who continue to have needs that aren't an easy fix. We formalized this concept by creating Wellness Wednesday, where we committed to blocking an hour as a team to use for whatever in that time you needed for yourself that was away from the work computer or phone. Other times we just talked about the wrongness of things, or sometimes just went around and gave a name to the emotion that was being felt and didn't have to say more than that. We set best practice standards as a team, and I named my expectations for the team and what they can expect from me. I created a lead role within the team that represents the community health worker position, and that person is involved in all operation meetings. I continue to collect feedback regularly from the team and identify where changes can be implemented. When team members shout out others within the network, I send emails to their supervisors and include the person being recognized. Do you know one person had worked in a team for over 5 years and their work had never been recognized? We pseudo-adopted a person not in our department and have added them to our birthday list and gave them a certificate as an honorary team member. In many places we all work, teams and departments are siloed. So part of the work is recognizing the importance of how we rely on so many different teams and roles to be able to get our jobs done. Building relationships and fostering and learning and collaboration are key to thinking beyond ourselves, and is needed to continue to remember that we are all human and as such valued. There has been so much laughter, tears, loss, and death in the past year, but most importantly, trust was felt with this team, and each one now has said in their own words that I am accepted for who I am and what I can give or not give in this team. I remind the team regularly that this is not about perfection, but it is about showing up and doing the best that we can, and each day that will certainly look different. Now, I certainly don't have this all figured out, and you bet that I do and will continue to make mistakes, but I make the effort to try, and in turn, each of the team does as well. And when one can't, that is accepted, because it is communicated with the understanding of I am a person first, not just the role I was hired to be. I would be remiss in saying that though this has certainly been powerful in and of itself, showing up authentically as a white leader means pursuing accountability for the systems we work in to do better. As advocacy is a tenet to the profession we have chosen, and leadership is both a choice and a responsibility, those of us also need to push for our systems to facilitate change which better supports employees of color. So I will leave you with some final thoughts, and perhaps you can take this back and evaluate where there is opportunity to make some changes within your team and your organization. The foundations of the systems we work within or interact with are based on the standards of whiteness. So when you start with that, you can pretty much evaluate anything that has been set up as an opportunity to identify who does this ignore, exclude, and harm. If you prefer a reframe, then one could say the opportunity to be more inclusive is endless. I will say the caveat to these thoughts about to be shared is that this really focuses on supporting direct service staff, but I suspect can be applied to other roles as well, particularly positions whose salaries are on the lower end, because our society has set that up to be the most frequently disempowered. So I share with you the thoughts and discussions I have had when thinking about this, and by all means, what I share is not exhaustive, but just a start. In this change from office/community work to more home work, have you had conversations with senior leadership about stipends or reallocating office funds to better support ergonomically safer setups for staff at home? Or perhaps discussing a stipend for better internet connection or devices to strengthen one's signal? Is there opportunity within HR to create levels within job positions so that more experience and not just education supports financial growth in one's role? Have you thought about the questions you ask candidates and discussed with HR the screening process for folks to be considered? What intentional time have you set aside to discuss learning or self-care plans with individual team members so you can support them in something beyond the metrics of their job? Are there opportunities to connect direct service roles to senior leadership to share perspective and to do some grounding in the day-to-day reality of one's role? Have you created intentional time for team members you support to talk about something beyond work? Have you taken a look at the roles that represent your organization and all these recent DE&I groups? And are there people from the community involved or direct service or frontline workers and not just leaders part of these groups? Advisory groups can be a great thing and contribute a lot to providing perspective when many organizations are contracting out to these third-party groups. How are you creating space for differences to be heard, valued, and more importantly, what are you doing to implement what has been shared into practice? When was the last time you evaluated the work of your operating procedures and collected feedback from staff to determine opportunities for workflow revision? Lastly, sometimes it is just about naming what cannot be changed and to helping to remember the why each person shows up for work. Some of these thoughts can certainly be implemented on their own as a leader of a team, and others cannot be done without support from various departments or roles. But you are not being authentic to what most of us profess as important values to ourselves or profession if you are not pushing to create opportunities for employees of color and direct service staff. So thank you for taking the time to listen to what I have shared. Thank you to Lakia and the Network Social Work Management for providing me the opportunity to speak these words. I hope you continue to do the hard work that all of us signed up for when we got into this field because of the belief that change is possible.